First of all, hello and welcome to our nearest University Faculty of Nursing scientific activity. I am Research Assistant Kemal Elyeli. I want to present about the program flow. Honorable Dean of the nearest University Faculty of Nursing and Vice Dean, distinguished teaching staff, dear nurse prospective colleagues, and all the listeners. Welcome all of you to our meeting on the way of nursing, which we organized within the framework of the scientific activities of nearest University Faculty of Nursing. Firstly, I would like to invite to nearest University Faculty of Nursing lecturer and Scientific Activity Commission President, Professor Dr. Firdevs Erdemir, to make her opening speech.
Good afternoon. In this event, which we name it as Meeting on the Way of Nursing, our aim is to provide an opportunity to our students, being together with our colleagues who have been pioneers in various fields of nursing and who are role models. Our guest, today, Professor Sultan Kav is one of the best for this aim, I'm sure. She has strong professional background at international level and worked with, I have also have a chance work together with professor in the past and worked at the same faculty. I know that Professor Sultan Kav touched the lives of many nurses and many students, as well as oncology patients' life. I hope that this short meeting will leave positive touch in your life also. Professor Sultan, thank you very much for accepting our invitation and joining us.
Thank you for your meaningful speech, Professor. I would like to invite Dean of nearest University Faculty of Nursing, Professor Dr. Ümrandal Yılmaz, for her opening speech.
Good afternoon, everyone. Dear Professor Sultan Kav, thank you so much for being with us today. I am sure that all participants and our students will enjoy and will be informed your experience. Thank you for your contribution again.
Thank you very much to your contribution, Professor.
Thank you.
I would like to invite the speaker of the speech, which is entitled Meeting on the Way of Nursing. Before giving the stage to her, I want to give information about Professor Dr. Sultan Kav. She received her Bachelor of Nursing, a Master and PhD degrees from Hacettepe University School of Nursing in Ankara, Turkey. She has held a range of nursing positions, including clinical nurse, nurse supervisors, oncology nurse, educator, and research coordinator. She has over 25 years experiences in oncology nursing, is an active member of national and international organizations, namely Turkish Oncology Nursing Society, International Society of Nurses in Cancer Care, European Oncology Nursing Society, Oncology Nursing Society USA, and Multinational Association of Supportive Care in Cancer. She served on International Society of Nurses in Cancer Care, Multinational Association of Supportive Care in Cancer, and European Oncology Nursing Society Board, and was a former president of European Oncology Nursing Society. She was the recipient of the 2010 Oncology Nursing Society International Award for contributions to cancer care, and prior to this, she received Multinational Association of Supportive Care in Cancer Young Investigator Award in 2004, and Best Young Investigator Award in 2005 for her research studies. She has been a member of European Journal of Oncology Nursing Editorial Board and senior editors of Asia Pacific Journal on Oncology Nursing. Professor Dr. Sultan Kav has awards at both national and international levels. She has a mother of two. Yes, Professor, if you are ready, you can start your presentation. Stage is yours.
You're welcome.
First of all, I would like to thank this opportunity to speak with you and being with you today. It's a really big honor and privilege to remembering all the memories and looking back, and also gives me a momentum and motivation to go further. And it's really a big whole week for me when I prepare myself for today. I would like to start with the presentation about my career. Just a second. Okay, I have a little bit problem to sharing. I think it's already there. And I would like to give some personal reflections on my way to nursing, especially the cancer nursing. And I hope that this presentation will inspire you to perform your potentials for your career. I was graduated from nursing high school at Çukurova University, Balcılı Hospital, right now it's the name, in Adana, Turkey in 1987 and graduated in 1991. And the photograph, which is the first day at the hospital for clinical practice, we were at the general surgery unit, and we were 6 of our colleagues with our teacher. And our teacher told us that please be confident and try to be cool, because usually the students goes to clinical practice, and then when they enter to the room, they follow after their teachers. And we did the same. And we were really lucky to have such a great patients to start with. But as you see on the pictures, we were like a adolescent, very, very young. And when I was graduated from nursing high school, I wasn't at my 18th, but I had to work about 2 months at the pediatric unit, and it was a really unique experience. And you see our team when I was leaving the clinic for university education. And then I have started to do university education for bachelor degree at Hacettepe University in Ankara. And I didn't work at the first year of my education, but then I wanted to start to working as I have entitled to be a nurse. And I have started at the Hacettepe University Hospital, which was a mixed unit with the oncology, hematology, and general medical disease patients. It was really hard for me to handle the patients because it was really demanding. We had bone marrow transplant clinic, we had radiation oncology, we had also all kind of like liver disease, kidney disease, and oncology and hematology patients. So I felt that I really need to expand my knowledge and skills in this area. So I decided to continue to work and to develop myself. And my aim was to be an educator nurse to share my experience. And I have graduated in 1995 and this is the picture from the graduation ceremony. And this picture is also, which is one of my mentor, Nurgün Pilatin, and my colleagues and my peer, Elif Gürsoy, and our one of teacher with Professor Füsun Terzioğlu. This was my first international congress in 1996 in Greece, and when I was studying a bachelor degree, I did my membership to Turkish Oncology Nursing Society, and I was already on the board as a board secretary. And together with Professor Besti Üstün, we had a chance to join to the educational workshop for European countries, learning to live with cancer. And I Can Cope program, which was inspired educational program developed by Judy Johnson in USA and expanded to other countries. And this program was the European version of the I Can Cope program. And we had a great sharings and a program, but we were really disappointed to not being able to perform when we back to our countries. We had some struggles to do this type of multi-professional educational program. But we got lots of connections and lots of movements to develop further our patient educational activities. And 2 years after, I was able to participate to the first EONS Spring Convention in Leuven, Belgium. And this was also my first scientific presentation as my master's study being accepted as poster presentation. And we were 3 from Turkey, Professor Nurgün Pilatin and Associate Professor Hatice Balcı Yangın. She has also presented her master's study. This was a really great experience and moment also for me to seeing the both young generation and senior nurses around Europe. And this was also the first European Oncology Nursing meeting. During the educational workshop for European countries, first time I saw the EONS president, Katie Redmond. She was a young, energetic, positive, and really good-looking lady from Ireland. And I was so surprised that, because you imagine that being the president of the organization like this should be the more senior, but she was really energetic, and I was so impressed and inspired, and I was dreaming that could I be with her place some days. And I explored later to her that it was my really a great role model. And also I was appointed to the newly established oncology nursing oncology hospital at Hacettepe University as an oncology nurse educator and research coordinator. And part of my preparation, I had a chance to go to University of Pittsburgh Cancer Institute as a visiting nurse. And this was a life-changing and career-changing experience for me. And I had, my mentor was the Joyce Amiasco, which I know her from her publications. And my 2 supervisors was Cheryl Still. She is still active in UPCI. We are still in communication. And Deborah M. Rust. And she was, at that time, nurse practitioner coordinator at the University of Pittsburgh School of Nursing. Because of those connections, I was able to see the both clinical side and also the PhD program and nurse practitioner program at the university. And my other colleague, Rosemary Miller, was the nurse manager at the UPCI. And I had many personal experience as a guest in her house also. And the other pictures also Professor Rosenberg during the physical examination class at University of Pittsburgh School of Nursing and the colleagues from different regions. And I was able to also follow the research courses at University of Pittsburgh School of Nursing. And for me, it was the first observation at the hospice center. Before that, I wasn't aware of that kind of program, and also working the palliative care team, which we hadn't at that time. And inpatient research clinic, and I had the permission to use this photograph to share with my colleague. She was the clinical trial patients for trastuzumab. Now we are using very often, but in 1998, because that drug also was an investigation. And I had a chance to work with bone marrow transplant unit at Children's Hospital with Colleen O'Donnell. And I was also, because we had Turkish transplant patients. During my spare time, like evening or during weekend, I was trying to help their patients and families as a translator and also helper. But also this gives me a chance to observe both intensive care and bone marrow transplant units. And my supervisor, Cheryl Steele, provided me a great opportunity to participate to the Oncology Nursing Society's educational course, which at that time called a Paul Institute in Dallas, Texas. And I have still written my emotions in being in the room with 1,500 oncology nurses. Most of them were in very high level, and the program was full of the new developments in oncology nursing. And I was so happy to be with that, I mean, breathing that environment and seeing and feeling the power of nurses. And of course, when I was in Pittsburgh, since the Oncology Nursing Society has been established in Pittsburgh, one of my first actions to go to visit the Oncology Nursing Society building and also sign up for membership. When I was doing my master's study, I was copying all the cancer nursing journals and Oncology Nursing Forum journal. And this is in a history, but in 1995, even at the main library, we were not able to reach the journals. So I was collecting all the journals, and being a member of the ONS was like I received the nutrition, and I'm feeding up every month with the new developments. And when I back to my country, I was continuing to work with the Oncology Nursing Society, Turkish Oncology Nursing Society, and I was also part of the board. And I would say that my career developed through the active involvement in the professional organizations, both national, especially the Turkish Oncology Nursing Association, and in the international later on, most importantly, the EONS. And some of the activities that I have involved and being a part in the organizations that I will give As the Turkish Oncology Nursing Society, I would like to memorize also Professor Leman Birol. She was the founding president of TONA in 1989. And I've been a long time and long-term member of the Turkish Oncology Nursing Society, board member, president, vice president, and board member, and still involving actively. And in 2000, I was nominated by Turkish Oncology Nursing Society to the International Society of Nurses in Cancer Care Board. And I was appointed as a board member. And this was the picture and reminds me lots of great emotions, because when I first learned that I was appointed, and my first reaction was like, oh, how I will be the same stage and on the same table with Kani Henki-Yabro. Because the cancer nursing textbook is so important, and I know that she's the editor of the Seminars in Oncology Nursing Journal. And Judy Johnson, that's my great mentor later. She was the creator of the ICANN program. And Margaret Fitch from Canada, Anne Hilton, and colleagues from China, the Netherlands, Brazil, Israel, Zambia, South Africa, UK, South Africa, and from Japan. And I was so young and so happy to be with this group. And this was one of the pictures taken in UK during our board meeting. And I have continued on the research committee and also awards and nomination committee later on. And supportive care in cancer, which has also the journal, well-known journal. This organization is unique because physicians, dentists, psychologists, physical therapists, social workers, all the healthcare professionals involved in cancer care consist of the association. And also I've been a member of MASC since 2003, and I had a chance to be an education study group chair. And together with the group members, we had developed several studies and also produced a guideline for patients receiving oral agents for cancer. This guideline has been developed and translated into several languages and used in clinical practice and still using in research. And before the development of the guidelines, we have looked at whether the nurses involved, patient education and follow-up for patients only receiving the oral treatments. Because usually the nurse's role, seen as part of the, giving the IV treatment, and therefore, if the patient received the only oral cancer therapies, they may not see the nurses. But this also gives losing the opportunity to getting the education and following up by a nurse, which we showed that from the Turkish study, we expanded to other countries, 15 countries, and we show that the situation is the same in other countries. And from that point, we wanted to develop a guideline that healthcare professionals can use in daily practice. So this guideline also has been inserted into national guidelines and also applications, like phone applications. And along with that, in 2005, I was appointed to the board of the EONS by Turkish Nursing Association. And I've been elected to the board in 2005. When I finishing my board member position, President Sarah Faithfull asked me if I would like to put myself for the president-elect position. And I was really hesitant that whether my language or my situation, family situation, because I had 3 years old, almost 3 years old son, and work environment would allow me to put myself forward. But I was really lucky that, and thanks to my institution, my family, and my colleague, that they constantly supported me during this period. So I was elected as a president-elect, which means that I will be the president for 2 years and past president for another 2 years. So that means that I will be on the board about 8 years. It's a really a big commitment. But we were so lucky to being there. And you see the picture in Berlin. I was really sorry that only I had one colleague from Turkey to share this moment with me. And we had, because it was really difficult for us to travel and get sponsored. This is one of the interview in the magazine that you can also read from this link, and it was really exciting moments to start as a president-elect. As a president of European Oncology Nursing Society, you organized annual meeting for the European Oncology Nursing Society, also jointly with the European Cancer Organization, which is huge. So I was able to chair the Congress, which one of my best is EONS 7, which was in Den Haag. We had a great number of abstracts and great number of participants from Turkey. But we had also crises during the ash clouds in Iceland. We were stuck at the end of the Congress. So all these people were in airport, at the hotel, and we didn't, I mean, all the airports, terminals shut down, and it took like a week to find the way to go back to Turkey. So we rented a bus first. We traveled with the bus till Italy, and then we took a boat trip to Greece, and then again with bus to Ankara. So it took 6 hours of adventure, and it was unbelievable moments. But we were so happy that we all got home safely, and we had a great memories, and it is still written. And the Congress also, we had 13th anniversary. We were trying to get EONS Congress to Turkey. We applied several times, but at the end of my term, we were able to perform the Congress in Istanbul in 2014. And the anniversary event also organized in Royal Marsden Hospital in London, because the EONS has been established with leading person Robert Tiffany, whom was a manager at the Royal Marsden in UK. And we had also EONS 8 meeting in Switzerland between 2 meetings. And we had also great memories that I would like to share with you.
This is the moment, this is the day, when I send all my doubts and demons on their way. Every endeavor I have made ever is coming into play. It's here and now, today. This is the moment, this is the time, when the momentum and the moment are in rhyme. Give me this moment, this precious chance. I'll gather up my past and make some sense at last. This is the moment when all I've done, all of the dreaming, scheming, and screaming become one. This is the day. See it sparkle and shine, when all I've lived for becomes mine. For these years I faced the world alone, and now the time has come to prove to them I made it on my own. This is the moment, my final taste. Destiny beckoned, I never reckoned second best. I won't look down, I must not fall. This is the moment, the sweetest moment of them all. This is the moment, 10 more beyond. This day or never, I'll sit forever with the gods. When I look back, I will always record, moment for moment, this was the moment, the greatest moment of them
I hope that you feel the excitement and energy surrounded by people involved in the Congress. And this meeting also really special for us that Professor Nurgün Platin received an award for lifetime achievement by EONS. And we successfully organized also EONS 9 meeting in Istanbul, Turkey in 2014. And this is also one of my first panel speaker experience in United States during the ONS Congress with the colleagues Alex Malasiotis, Margaret Fitch, Judy Johnson, and Ron Chi from China. And this is another memorable experience that I was a keynote speaker at the International Conference for Cancer Nurses. And this, another one is the first Asian Oncology Nursing Society conference in Bangkok, Thailand. And this picture is taken with the student nurses and Congress chairs. And as already been mentioned during the opening, I have received award for my studies and also for the contributions in cancer care. This is really when I was traveling to another country, I tried to visit the clinics and meet the nurses and share their practice and inspiring and learning from each other. These are the pictures from the countries that I have visited. And when a person decides to become a nurse, they make the most important decisions of their lives. They choose to dedicate themselves to the care of others. And when you choose the nursing, you really have the dedications to making a difference for your patients' life and their families. And this is my last part of my presentations. If your actions inspire others to dream more, learn more, do more, and become more, you are a leader. And it is up to you that if this presentation inspires you to dream, learn, and do more, become more, that means that I am the leader. So thank you for your attention, and I'm happy to take the questions.
Thank you very much, Sultan Hoca.
If you allow, I want to ask a couple of questions, Professor. You are an active member of many national and international organizations related to nursing. What benefits does it have for you and your profession? Professor?
Sorry.
Yes, madam, I want to repeat this question again. If you allow, I want to ask a couple of questions to you, Professor.
Sultan Hoca?
Yes.
If you're all right, Kemal Hoca, he will ask some questions about your profession. Is that comfortable? Yes. Okay, so yes, please, Kemal Hoca.
Okay, you are an active member of many national and international organizations related to nursing. What benefits does it have for you and your profession, Professor?
So the involvement of the international organization?
Both of them.
All of them. First of all, it gives you a confidence that you are on the same stage, and you are also sharing the same challenges and obstacles, and you inspire people by seeing the different sides of the the clinical, could be the clinical practice, or the issues like political issues, such as like lobbying, establishing the clinical nursing specialist role, and you see the examples, lots of examples. Also, you have the really good connections. For example, when I was first doing the national survey on the nurses' role on patient receiving oral chemotherapy, when I presented to the at the international conference, the suggestion automatically came that why we are not expanding the survey to the other countries. Then we had a connections, we had a support grant from the study group that we were able to reach different parts of the world, then show that the same situation exists in other countries. No matter whether they have developed countries or underdeveloped countries. So it gives a big evidence. And power also to start to change the situation and enhance the nurse's role in patient education. So this is, I think, one of the good example that why you involve to international organizations and also, be brave and speak up to the people. And the other, benefit that I could say that, of course, this is our second language. We are not fluent to speak, and this is your opportunity to develop your speaking, writing, reading skills. And, when I was a nursing student, I really worked hard to improve my English. And at that time, I searched for the opportunity to go out to abroad to study, but there weren't Erasmus program or any exchange program, and I'm Erasmus coordinator at my faculty because of my connections. I'm trying to help our students to get clinical placements, or at least, their connections can help also. And also another benefits is having, again, the joint projects, both European Union projects or other international projects that you can easily have the partner. And I don't know what to say because there are many opportunities to being involved, and I don't see why not to involve to international organizations. And of course, you may say that I spent lots of time and I gave great effort to travel, especially to Brussels, because the office was located in Brussels. And I gave lots of time and spent lots of time for visa procedures. And I traveled during the night and arrived in the morning and had the board meeting and returned on the same day. And next day I was at the school. So it's not, of course, easy, but it's worth it. So of course we didn't have this kind of technology to Skype or to do, online meetings. That one of the things that I wish to have more during my time to having such technology-based communication, because it would ease your, time and consume your time also and energy. But of course, I'm really happy that I was there. I was at the right place with the right people, and I was aware of my challenges as well. Again, I would like to thank all of my colleagues and my institution for providing such opportunity.
Thank you very much, Hocam. Yeah, really, it's really great to hear from you. And both of us with Kemal, we used as you Erasmus program. And when we have been other students, it's a great opportunity. Yeah.
But also try to share your study, and when you graduate, I think my advice would be, whenever which area of nursing you choose, look at the opportunities to develop your career, both involving national and then international organizations, and give your time and presence to involving the study groups or membership. Not membership, the committee works, that you can get different perspective, and also you contribute. When you see that you are contributing, that gives you a great confidence also.
Yeah, thank you.
Thank you, Professor, for your gently reply.
I was not sure that whether my story or my career development would be interest of your students, I'm happy to take other type of questions also.
Sure.
I'm sure that it will inspire a lot of students, I'm sure.
I think so, Hocam. So I want to ask another question to you. What are your reasons for choosing oncology nursing?
It was by a chance, actually, because the oncology clinic was my first clinical placement during my university education. When we finished the first year of the school, we had summer practice. So my first clinic, not in Adana, but in Ankara, was oncology clinic. And so when I applied to the hospital, so they were a big workforce shortage for nurses in that clinic. So they asked me if I want to work, since I know from the clinical practice, and I said yes. But seeing the patients and their families big needs, I decided and dedicated myself that I should continue to this area. So it was actually the influences from the patient and their families, seeing the needs.
Yes. Thank you so much, Hocam. Can you compare the nursing applications between our countries and developed countries, for example, USA, and other European countries? What can you say about this, Hocam?
Mm-hmm. The nursing practice, actually, we, for the developments for example, in the medication or the treatments, we can say that we are almost the same level. I mean, the patients can reach the latest developed technology and the drugs, but it's not, I mean, when I first compare our country and the other countries, I see that, yes, they are reaching the technology and the treatment options, but it wasn't parallel with the nursing care and follow-up and the autonomy that nurses has. And the big difference that I would say is the specialist nursing positions in other countries, especially in oncology, that it's really needed. That because, for example, in UK, in northern European countries, in Thailand, in Taiwan, for example, in Japan, in China recently, they developed a clinical nursing practice position. Although we have established the postgraduate education, we don't have a strong position and place in the clinics. And also the advanced nursing practice, we are lack for that, and the nurse practitioner program. And during my observation, patient had the bone marrow biopsy by a nurse practitioner, and he was saying that, I mean, I've been coming to this hospital for 10 years, and each time she sees me and she has done the bone marrow biopsy. So do you do the same in your country? I said, no, because the bone marrow biopsy or lumbar punctions, it's not nurse's responsibility, but also they were prescribing the symptom management drugs, and but it's not part of our role. Even you have a PhD, it's not established in clinical area. We don't have position. That's really sad that we are still dealing to get clinical nurse specialist positions in every area in nursing. Although we have the law, nursing law, which recognize the specialist nursing position, but I mean, it's recognized only the title. Again, we need place and position at the clinical practice to advance and empower the nursing presence.
Thank you so much for your reply, Professor. According to your speech, I want to ask one more question. And what kind of studies you plan to do in this field about solving this problem, solving the situations about nursing and nursing status, and what are your goals about it?
It's a big question. I wish to say that there is an easy answer for that. But yeah, I have been part of the Turkish Nursing Association's specialist nursing study group. And we are actively involved at the Ministry of Health level for the recognition of the specialist title, nursing specialist title. But we are still long way to go. We are not there yet. We have been also involved to several other activities at the Ministry of Health level, but it is, part of, by invitation or involving the association work again. But of course, this is important, but we need to build a system to sustain these efforts.
Okay, John, thank you so much. And last, what is your suggest to nursing students, John?
I think I have already stated that.
Yes.
Whenever when you graduated from the school, please try to stay in your area, involve to your national organization, and seek to being a member of the international organizations, and involving and being together makes you stronger and gives you a motivation to continue also.
Yes,
So,
thank you very much,
believe in
Professor.
yourself and believe in your potential.
Thank you. We have several questions from the chat. Actually, some of them I think you already answered. One of our students, James Olyanka, he asked what your advice for the young upcoming nurses, but I think you already answered this question. And he has a second question. Can I start work as an oncologist after the school, or I have to take the special course before I can start to work as an oncologist? Thank you.
I mean, the oncology nurse? You mean?
Yes, oncologist nurse, I think. Mm-hmm.
It depends on the country. Because some procedures needs a certification. Depends on the countries. For example, if you are working in Turkey, of course you can start to work with oncology patients, but like working with ambulatory clinic or outpatient clinic may require the certification, specialist certification. It would be nice if you have, or you can start with the oncology, working with the oncology patients, and then you look and apply for the certification course. And the other countries, there is a postgraduate courses. For example, in Denmark or like Switzerland or other countries, there is a specialist education that you should follow. Although, it depends on the country regulations. But first you need an experience also, and together with your experience, you can have both theoretical and practical education. But definitely, the working with the oncology patients care or cancer care requires specialist knowledge and skills.
Thank you, Professor. Also related, I think, to this question, we have another one question from the student Eminike Oppo. He is interesting. Does North Cyprus have a nurses association, or are they using the same as a Turkey?
I'm sure the North Cyprus has a nurses association.
Yes, actually, I can answer. Yes, we have nowadays we have a nursing association, and actually one of our teacher, the assistant professor Dilek Sarkaya, she is the one of the member of this association. So I think, Emenike, if you would like, if you are more interested about like North Cyprus Association of the Nurse, you can write the email to the Dilek, Miss Dilek, okay, and she can answer you. I'm sure that the professor can more help you with the Turkey Association of the Nursing, but if your question was about the North Cyprus Association of the Nursing, I think you can ask it from the Dilek, Miss Dilek.
Yes, and also as a student nurse, you can be part of the association work, because National Association, Nurses Association, have also student nurse working groups or groups, study groups. For example, in our country, we have the Student Nurse Association, and each universities I know, or countries that I know, they have also Student Nurses Association. And there is also European level of Student Nurses Association that you can be involved. And the other one is because with the changing situation in healthcare and the shortage of the specialist healthcare professionals, many organizations now trying to attract young nurses to involve to their association work. And EONS also following the same strategy, that they are having the young cancer nurse network, and also appointing the young cancer nurses on the board, and trying to attract nurses, younger nurses, to choose and to stay in cancer care, and the other associations also, because with the new generation, we know the volunteer works. I mean, it's all volunteer, and it's your freedom to choose or not. But it gives you a great sense of belonging, and also coherence and power.
Thank you very much. We have more questions. Actually, I'm sure that your interview, it's too much inspired the students. They even writing, they sharing with us their feelings. And we have more questions. The Abimbola Curry asked the question: as a Nigerian nursing student in nearest university, would I be allowed to my house job in Turkey, as well as attended to the patients, like you have the chance to work with others countries without discriminations?
The discriminations means I'm not sure if I got this. With other countries without discrimination. I mean, are you asking a part of the the procedures to get licensed in Turkey, or working in the clinical practice, being you know, or coming? Are you, in terms of the cultural differences or gender differences? I'm actually not sure if I got the point.
Actually, I think a student is asking, like, if she will, after the finishing our university, nearest university, nursing faculty, if she will wanted to go work to the Turkey, will she faced with some, will she have opportunity to work in a Turkey as you had opportunity to work in America without the facing some discrimination problems? I think that the student was asking this.
Okay. So when I was, you know, I was observing the clinical practice during my visit in UPCI. I involved a very little patient care activities, which was written on my agreement. And after that, I was able to work only as a data manager at the UPCI. You know, you need to have the nursing license to apply, and it has a long procedures to follow. So it's a different pathway. But if you are working in Turkey, also I'm sure the Near East University graduates has the graduation certificate. I say that the recognition in Turkey. I mean, this can be, I think, answered by you where they can work or not. But in Turkey, if they are saying, for example, we have also students, international students, and in clinical practice, they are really welcome to the students from different countries, and they are not seen different or, you know, or stranger, because we have a couple of students also, international students, and they have some language barrier, but of course you need to have a language exam, and also you need to get your recognition by the Ministry of Health in order to practice. That's the same in everywhere.
Thank you very much. I think, this same student, the Bimbanol Kuris, she asked another one question, like, what is required as a student nurse in North Cyprus to join the Turkish Nursing Association? So I think you already answered it as a part. And also, at what is required as a nursing student to volunteer in the hospital? Like, is it possible to volunteer in the hospital in Turkey? I think she's asking in Turkey.
You mean for clinical practice or?
Clinical, yeah. As a nursing student, like to have a nursing student clinical practice, but as a volunteer during the study.
I mean, because of the COVID situation, of course, it depends on the institution policy. So they should, I mean, if it's part of the Erasmus or international collaborations, they should follow the international relationship office requirement or their department coordinators guidance. But otherwise they can, you know, I know some private institutions, they are opening the summer course or summer club for nursing students, they can follow. I mean, there are several options and opportunities, but the COVID situation makes a little bit harder to get acceptance.
Yeah, unfortunately, the COVID situation influenced and changes, made a lot of changes. Thank you very much. Some more questions. One interesting question from the same student, the James Olyanka. For a nursing guy, which department will you advise him to special in the after school? So, like, he mean, what is the profession for the nursing student as a male? More value, more advice. I think he mean this one.
You may you may see on the photo that sorry. There are male nurses also in cancer care or other areas. I mean, I think there is no limitation or restrictions to choose your specialty area.
Thank you very much. Also, one very good question for Nelly Komolafe. How can one also join the International Nurses Association?
International Nurses, I mean the ICN, International Council of Nursing?
Probably.
Or any international association. I mean, you can look at their, because you are now student, and you can look at the student membership options if they have, or if they are allowing, or you can, be volunteer to ask whether you can, be part of the, for example, joining the conference or any type of educational activities. You can ask.
Thank you very much. And one more question, also, in my opinion, very interesting. Does NCLEX exam hold in Turkey? And is it possible for an international student to participate in it? For the question from Denveze Victoria.
Yeah, we wish to have the general examination like NCLEX in Turkey. We don't have yet, but some schools, they are doing the, part of their final year practice or intern practice. They are having the exam, but it's not the national board exam. There is no NCLEX type of exam exist in Turkey yet.
Thank you very much, Hocam. Are they NCLEX center in Turkey? The Akin Vumelis is interesting.
NCLEX center, as I know, there is no NCLEX center in Turkey. No, I mean, as I know.
Nelly Komolafe during this topic is any international nurses association in Turkey? I think he wants to ask. She wants to ask.
I mean, the national associations be the part of the international association. For example, the European Oncology Nursing Society is an umbrella organization that has the society membership, or ISNCC, International Society of Nurses in Cancer Care. It's an umbrella association or society that accepts the society membership. For example, MASC as well. Or Federation of Nurse Educators, or European Federation of Nurse Specialist organizations called ESNO. It's usually the national organizations become a member of international organizations as a society. But international, as an international organization, I mean, it depends on the statute of the organization that they may accept the international members. They can look at the statute if they are accepting the international membership. But usually it's open to their national members. And if they are part of the international societies, gives benefits, like, for example, when you are the Turkish Oncology Nursing Association members, you are also a member of EONS. So you can get benefits from there. I mean, there are several membership categories: society membership, individual membership, or group membership.
Thank you very much. Thank you, Hocam. One more question from Mohammed Amina, one of our students. As an international student here in nearest university, are we eligible for licensing, and what's the process like?
Licensing.
Mm-hmm.
Again, it's the same question. I think it has been already mentioned.
Yeah, thank you. Another one student, Akinwumi Lizzie, asking, as the nearest student, nursing student, are we allowed to work in Turkey?
I think yes, but again, you need to have some procedures.
Yeah, also there is the duration for this topic from the Eminike Ogbu. As a graduate nurse from the North Cyprus, do I need a license from the North Cyprus Nursing Association before I can work or study in Canada or Australia, or just the BS certificate from the university?
Mm. It's again depends on the country that you are applying. They have the office for the graduation, the graduates in outside or abroad. So you need to check the requirements.
Thank you very much, Hocam. One more question from the Bimbo Keru. As a nursing student in Nearest University, can I come volunteer in the COVID group at the moment? And is there any certificate awarded for any volunteering in the hospital?
I mean, it's again difficult to answer. It depends on the institution that you apply. I mean, I don't have a specific answer for that.
Yeah, for COVID, it's hard. Just can I add something like for example, licensing the previous question? Yes, for the Turkey, actually, we are fully accredited, like for the nearest university for Turkey. And if you, as a nursing students, if the graduates, they can take a license from the North Cyprus, the Nursing Association, the questions that we mentioned before, actually. You can find the information, the full attribute, because of some of them they asking, like what is the process, right, for the licensing here in North Cyprus. You can find the information or from our faculty or from the international office. It exists the procedure, official procedure of it, and it's possible, yes. And we have one new question from the Nelson Onyeneke. While you were working as a council care nurse, what were the challenges you faced and how did you manage it?
Yes, I mean, the challenges makes you to find your way to go. I mean, there were lots of challenges, of course. First was related to for example, the protection, personal protection for both, for ourselves and for patient and their relatives, which that situation has changed a lot during our time, and like spill management. I remember going and searching for equipment for spill management with our colleagues, and like a kit for catheter care, because when I observed the practice. There were prepared there were a kit for catheter care. So there were refill for flushing the catheter and sterilized pads and injector, and so it makes patient relatives' lives easier because they can follow the instruction and they can, you can easily teach the relatives how to do the flushing or changing the dressing. But we didn't have kind of kits, for example, in Turkey. So we tried to get this the same. Also, we didn't have the different types of the drugs formulations for the symptom management. And we also, I'm trying to, the educational materials also, patient educational materials, and also like Look Good, Feel Better type of patient empowerment programs we didn't have at that time. But now we have more, and we have, more demanding patients and families. So we are also improving our services. We had big issues for a number of staff when I was working in clinical practice, which still in case we have heavy workload. It's still continuing, but it's changing step by step a little bit. There are good developments like robotic chemotherapy preparation, because also we had, during my clinical practice, nurses were preparing chemotherapy and at the same time administering the chemotherapy in everywhere. Right now, it's a centralized unit prepared by dedicated healthcare staff, and we have guideline and personal protective equipment. These are the developments that are good.
Thank you very much, Hocam. And I have a last question from the one postgraduate.
So the educational program that I think we had modeled from other countries helped us to develop our practice.
Thank you so much, Hocam.
Thank you so much, Hocam. And we have a last question from the postgraduate our student, Christopher. She's asking, Professor, I would like to ask what distinguished steps you took to build your professional life as a nurse. And also, yes, she has a duration and how you were to build the consistency in your nursing career.
If you are asking that what was my motivation to keep going or staying, is that the interaction with the patients and their families, really the close relationship and interaction makes you to dedicate yourself, and it's a really important that, and maybe we are not aware, but we are learning a lot from the interactions and experiences that we are having as a bedside nurse or staff nurse or whatever we are doing. It's important to listening the patient needs and to also observing how they are, handling and coping with the situation, and working together to find solutions or to make the life easier or make them, to be efficient in their management of their daily life.
Thank you very much, Hocam. Thank you very much for your story. Thank you very much for the sharing with us, with our students, your professional experience. And I'm sure that it was inspired, really inspired for the good work, good inspiration to our students. Thank you. Yes, Kemal Hocam.
Thank you so much, Professor. According to your special file, Professor Dr. Firdevs Erdemir wants to ask a question. What can you say about the professional satisfaction with working oncological patients and oncological patients' family? What can you say about this, Professor?
So what is my, sorry?
What is your opinion? What can you say about the working with oncology patients and with oncology patients' family?
It's I will say that it's a really worth it experience, and it's a really growing also experience and rewarding experience, because of course every patients are special and unique, but you share their precious moments with them, and like being present with them and sharing and trusting the relationship take you further, and remember how you feel during the interactions, and it remains forever.
Thank you so much, Professor. Thank you so much for your opinion, for your presentations. And I would like to thank to all speakers and all audience for attending these 7 scientific events. So I think, Hocam, would you like to say anything? Or we can
I would
finish.
like just to thank the professor for her sharing with us. It was really exciting to listen.
Thank you for your organization and moderating the session with us. I hope that, again, this will inspire others to do more, to dream more, and become more.
Thank you very much.
Thank you very much, Professor. Wish all healthy days to everyone, and goodbye, everyone.